Today we're going to talk about the non-surgical treatment of jowling. So I have these two experts here, and I really want to dive deep onto what are some of the non-surgical treatments that we can do for jowling. So Brad, would you like to sort of tell us what some of your favorite treatments are?
I get to start? Yes. My favorite one is surgery, but of course that's not non-surgical, but it is decisive in how it treats it. What I really like, there's a lot of different ways to treat it, and we'll talk about them, but my favorite one way would be to use a device called Genius, which is microneedling with radio frequency. So it's a in-office, you numb beforehand, you do the treatments, and by the heat getting deep into the skin, it actually can create tightening and contraction of the tissue, and jowling is loosening of that tissue, so anything I can do to tighten it helps.
Right. So creating that energy to help with the tightness of the
skin.
Well,
I use the RF microneedling as well. I think it's fantastic, but I also use the InMode technology or FaceTite, so it's minimally invasive, but it's internal heating to get that heating and that shrink wrapping, and then with the RF microneedling on top, it's sort of hitting it from.
And it kind of does external and internal, doesn't it? In that,
exactly. So I think that's a great place to start. A lot of people aren't fortunate enough to have access to that technology, though. I mean, it's very expensive and it's newer technology, but it's becoming, in most good cosmetic surgeons, most people have some version of it.
If you didn't have the energy devices in your practice, you're younger, didn't have them, what would you do with your patients to help them?
Right, so we've talked about energy to sort of heat the tissue to help with some of that loss of elasticity. I think some of the aging we're seeing with the jowling is volume loss from the upper face, the mid face. You've lost the fat pads, and we're sort of seeing that descent, and then you see the jowling down along just the pre-jowl marionette area. If you can build up volume, so using fillers and things like that to
mid face and lateral cheek,
whether it's really help. In addition to the energy devices you both have talked about today, adding that volume for sure.
Almost always too, when I'm lifting to sort of lift the jowl, so the jowls are right here, and so we have a pre-jowl sulcus. So I do a lot of camouflaging. So if you put volume in front of the jowl in the fullness, and you put it behind along the jawline, and jawlines have become very, very popular, you basically, since it's a little too full, you fill everything up around it, and it disguises it too. So the elevation plus that with fillers can be extremely powerful.
And the other thing I've started using, and actually this is from Dr. Mulholland, is threads.
Yeah.
Thread lifts have been around for a decade or two, and first they were popular, and then they sort of got poo-pooed because it didn't replace the facelift, right? Because it's just not that strong enough. But in coordination with some of this energy-based device, Dr. Mulholland came up with the grilled cheese concept. We're putting in the threads and using the energy. I think one of the things we're really agreeing on is that it's non-surgically, it's a really hard problem to fix. So we attack it from multiple angles.
Right, so as plastic surgeons, we like surgery to treat problems, but for the non-surgical issue, sounds like multiple modalities with energy for heat, volume with the fillers, or using threading to sort of tighten some of that laxity. So there's not really one magic bullet for this. It's a difficult problem even after surgery, like you said, Brad, that it's still an issue that we have to treat, but having some non-surgical options that patients can come into the office for with minimal downtime is something they're looking for these days. They don't have that recovery built in. So
and it can be super helpful and super successful.
Yeah, and you guys really summed it up for us today, so thank you for being here
and
talking about the non-surgical options.